Hello, everyone. Welcome to Youthful Medicine. I'm Dr. Tahir, your rheumatologist and obesity medicine specialist. Time to time, I like to share some success stories about my patients, and today I'm going to share an incredible story about one of my patients who embarked on weight loss journey with me that not only improved her overall health but actively reversed several of her chronic medical conditions, and she's still in that process. But we are so happy and delighted with the success that I thought I'd share with you. So the patient is a 50-year-old female, and she presented with a uh, weight of about 181, with puts her BMI about 33, and her initial blood work showed hemoglobin A1C in the pre-diabetes range. She had elevated liver enzymes, which essentially confirmed that she had fatty liver disease, although further testing can be done when you suspect somebody with fatty liver disease is to get their um, ultrasound of the liver to confirm the fatty liver deposits. But in this case, I would call it a fatty liver disease because there's no other reason for her liver enzymes to be elevated. She had high homocysteine levels, which is another marker to assess for inflammation and increased cardiovascular risk. She had low vitamin D levels. She had high C-reactive protein, high sensitive cardio reactive protein, C-reactive protein, which is a cardio marker of inflammation, and hypertension with blood pressure ranges 166 over 118. At that time, she was taking combination medication of lisinopril and hydrochlorothiazide to manage her high blood pressure. So let's talk about the progress. So fast forward to today, after several months of consistent weight loss, her weight has dropped to 137 pounds. Um, Her BMI is now within its normal range, in the 25 range. Her blood pressure has come down to 127 over 85. And because of this, we've been able to start tapering off of her blood pressure medications. It's a huge victory in reversing one of the most leading cause of death, which is high blood pressure. Uncontrolled high blood pressure leads to heart attacks and strokes down the line. So, how do we assess patients monitoring uh, and assessing obesity related complications? Well, when we see a patient with obesity, we look at several uh, bioparameters and also biomarkers. And one of the ways that I would like today to go over with you my specific list of testing that I do for my patients. So I start with a lipid panel. They are lipid panels that also have a apolipoprotein be in it, which gives me a little bit better understanding of their cholesterol profile. So a lipid profile with apolipoprotein in it, along with comprehensive metabolic panel, which is fasting. So it gives us glucose levels, it gives us blood urea nitrogen, it gives us albumin and kidney and liver functions. AST, ALT levels, which in this patient were high, suggesting that she had fatty liver disease. I also include hemoglobin A1C, which is usually determines prediabetes or diabetes status. I also check for thyroid and free T4, complete blood count, complete blood picture to assess white count, hemoglobin, and your platelet counts. Also check for a urine analysis. We also include weight. We ask the labs to get the weight tested, as well as have our patient blood pressure monitored as well. Um, and then let's see, I also check for iron, total iron and ferritin levels, because iron deficiency anemia is common in patient population that we see. B12 and folate levels, which can be important when you are assessing nutritional status on patients. And then we also check for baseline pulse in the vital signs, vitamin D level, 25 hydroxy vitamin D, and the cardio IQ C-reactive protein, which is a marker of inflammation, and also it's determines the patient risk of having a cardiovascular event in the future. So this is what my initial testing looks like. And I'm proud to say that this patient had improvement in all of her profiles. Her blood pressure decreased, her glucose levels improved to now normal range. Her liver health has starting to show improvement. There's a reduction in her liver enzymes, which indicate liver recovery. The elevation of C-reactive protein, markers of inflammation have reduced. Vitamin D deficiency, I'm supplementing it with vitamin D, which is a hormone which really makes a huge difference in patients' health. And homocysteine level was high. I started with L-methyl folate, which is one of the supplements I recommend patients when they have high homocysteine levels. And in the next round of labs, I will see. I expect all her values to be within normal range. So there are not many medical conditions that you can reverse to this completion and also see so much reversal of other diseases. So by focusing on the weight loss and treating obesity first as the root cause of their health problem, reducing the need for the medications and significantly improving patient quality of life is achievable now. So you should not hesitate to take an action. Remember, if you or someone you know who is struggling with weight and its complications, taking steps to lose weight could make all the difference in improving your long term health. And finding a physician and the care team that can actually work with you for this journey is really important. And if you enjoyed this video and found it helpful, don't forget to hit subscribe button and turn on the notifications so that you never miss a video from Youthful Medicine. Again, Dr. Tahir, and I thank you for your attention. Let's continue the journey to a better health together.